The recent kidnapping and deaths of several Americans in Mexico, it highlights the potential danger of traveling internationally for medical procedures. The process, known as medical tourism, has become increasingly popular, with well over 1 million Americans seeking procedures outside the country. Emory's Dr. Winawer is joining us now to talk more on this, and it's good to have you back with us, Dr. Winawer.
Good to be here,
Hey,
Alyse.
good morning. So a very important topic, and one that we're hearing more and more about, obviously because of what happened to these Americans. Let's start with this. Do we know where people are typically going in Mexico to have these procedures or anything done?
Yeah, all over Mexico, but also Canada, other parts of South America, the Caribbean, the Far East, even parts of Europe. It really depends on the type of procedure we're talking about.
So why are people deciding to take on medical tourism? I mean, is it just simply the cost?
Generally, yes. I mean, these procedures are 40 to 60% cheaper on average in these other places, but it also may be availability. It may be really excessively long wait times, for example, organ or donation, and those types of surgeries, or they may have procedures that aren't available or approved yet in the U.S. that they're doing elsewhere as well. But generally, the majority of people are going outside the U.S. because it's so much cheaper.
So, I mean, what are the types of procedures? And you just mentioned several, but what are some of the most popular procedures that people are stepping outside the U.S. to have done?
Dental, that's a big one. Crowns, even extractions, cosmetic or plastic surgery, orthopedic treatments, hip and knee elective surgical repair as well. Fertility treatments are often not covered by insurance and can be tremendously expensive. So we see people going outside the country for that. We mentioned organ replacement and then cancer treatment as well, because many cancer treatments have high deductibles and people just can't meet them sometimes.
So let's talk about the typical risks, Dr. Winawer, the risks and then how we can minimize those risks.
Yeah. Well, the biggest risk is that you have a complication from the procedure, whether it's the anesthesia or whether it's a post-operative infection, and now you're in a foreign land. You might not speak the language. They may not have your medical records, so it could be a nightmare. So the biggest thing I would say is first speak to your doctor, make sure that you're safe to have a medical or a surgical procedure, rather. Do your research on where you're going and whether it's accredited institution and whether or not it's safe as well. That's a very important aspect, obviously, as well, when you talk about that. So those are the biggest things. And then you could get insurance as well. And then also having an advocate that can come with you that might speak the language if you are incapacitated, or they can speak to in the language that where you're going. That's another important thing as well.
So, I mean, just to be clear, you're not telling us that medical tourism is an option that we shouldn't consider. And in fact, I want to mention this too. Dana Fowle was on earlier, and she went to Mexico several years ago and did a story on a dental practices there and just the number of Americans. And she said Canadians that go, and that so many of those doctors are actually American doctors, which I thought was really interesting. So it sounds like you're saying know the risks and do your research and make sure that you've got everything, you know.
We tend to think that healthcare in this country is the best all over the world, and for certain aspects it is, but for other certain types of procedures it's very safe if you do your research and you make those contingencies which we discussed. I don't want to tell people that they shouldn't consider it. You just have to be very, very careful. And listen, if medicine wasn't so expensive in the U.S., we wouldn't be here talking about this. And if it was 10 to 20% more than somewhere else, people wouldn't travel. They wouldn't think it's worth it. And unfortunately, I think it's an indictment of our healthcare system in terms of the extremely high cost that people feel the need to go outside the U.S. But if you do that, I do want to be clear, it can be safe if you do your homework and you investigate it and you do the right research beforehand. So that's the biggest thing I think. Medical tourism, over 1.5 million people have gone outside the U.S. Last year. This is something, or before the pandemic, now that we're seeing the pandemic wind down, we're seeing more and more people do this again, as was evidenced by this case in Mexico. So make sure it's a safe place, make sure they're accredited, do your research, and I think it's okay.
So I mean, keep, going back to cost too, if you're talking 40 to 60% cheaper if you leave the border. So do you see this being a trend that continues to grow, despite this recent case of what we just saw in Mexico?
As long as medicine in the U.S. becomes more and more expensive over time, people will go outside the U.S. to have procedures. They're running in parallel. It's no surprise that healthcare costs have gone up and medical tourism has gone up at the same time. They run in parallel. So yes, unfortunately, yes, unless we can find our way, and this is a big issue. This is bigger than just us talking about it now. The politicians need to get involved. It's not greedy doctors. A lot of doctors don't make a lot of money for the procedure. It's just big corporate business, unfortunately, and we have to find a way to reduce those costs, and if we can, then less people will feel the need to go outside the U.S.
Systematic issues.
Completely.
Yeah, no doubt. All right, breaking this down for us, Dr. Neil Winawer, as always, thank you so much for coming in.
It's my pleasure.
Yeah, good to see you again.